Okay, I'm gonna keep my WhatsApp on, but I'm gonna take my earpieces out so you'll be able to talk to me. Hi, good afternoon. My name is Brenda Kelly. I'm a consultant obstetrician at the John Wycliffe Hospital, and I'm grateful to Wendy for inviting me along this afternoon just to touch base with you about COVID vaccination in pregnancy. So there's been a lot of misinformation in recent weeks around giving COVID vaccination to women who are pregnant, but also women who are considering pregnancy because of concerns around fertility. So what I would like to do in this short session is just bring you up to speed with what the current advice is. Now, the caveat with this is that things are changing quite rapidly. So before Christmas, there was a blanket sort of pregnant women shouldn't be vaccinated, and that's already changing in the past week or so. So the first thing to say is that we've been given vaccinations to pregnant women for many years. So we have got a good experience using the flu vaccine in pregnancy and the whooping cough vaccine as well. The COVID-19 vaccine, whether it's the Pfizer vaccine, the AstraZeneca Oxford vaccine, neither of these vaccines are what are known as live vaccines. So the first thing to say is that there is a long-standing safety record with the use of non-live vaccines in pregnancy and breastfeeding. The second thing I would say is that about 90 to 95% of the medication that's currently used in pregnancy has not been trialed in pregnant women. So the difficulty we have with looking at the data around vaccine safety in relation to COVID is that we often hear about the fact there's no long-term safety data. I'm not trying to falsely reassure, but what I would say is that that is often the case when it comes to medication in pregnancy and breastfeeding women, because many trials, in fact, the vast majority of trials worldwide, do not recruit pregnant women or breastfeeding women into their trials. So with that sort of caveating, what I would say is that at present, because of that balance between not having long-term safety data for pregnant breastfeeding women, the current status is that the vaccine will not be offered routinely to pregnant women. Now, that's a routine, that's to sort of all pregnant women, but there will be two sort of particular areas where we say, well, actually, it may be that even if there's a degree of uncertainty, that the benefit of giving the vaccine outweighs any potential risk. And those two groups are as follows. The first group of women will be women who, by virtue of a pre-existing medical condition or medication they're taking, if they were to contract COVID-19, they would be at risk of developing very serious complications. And so that group of women with pre-existing medical disorders would include, for example, women who are considered clinically very vulnerable because they are either on immunosuppression drugs, or they have, for example, got severe respiratory disease such as severe asthma or cystic fibrosis, or they have underlying heart condition or a solid organ transplant. And there'll be other medical conditions. But if you're a pregnant woman and you know that you've been classified or told previously that you're clinically very vulnerable to COVID-19, then if you're offered the vaccine, you should consider discussing that with your lead clinician, because it's likely that the benefit of being vaccinated would outweigh any potential small risk. Now, the second group of women who should consider vaccination will be the women who are in a position, an occupation where they are at higher exposure rate to COVID. So they're not necessarily at risk of developing more serious disease, but they're certainly at a much higher risk of developing COVID or contracting COVID because of what they do. And that would include frontline NHS workers and those who work in social care. So if offered the vaccine, I would suggest that you consider certainly discussing that further with your clinician, whether that's your GP, obstetrician or midwife, and consider the benefit of getting that protection, because you're going to be at much higher risk of exposure to COVID-19. So those are the sort of three things. So number one, not being offered routinely to pregnant women. But when this sort of prioritization moves through, as it's doing at the moment, from the over 80s and all NHS workers, moves through, you may be, if you're in a clinically very vulnerable group and you are pregnant or breastfeeding, you may be offered the vaccine. And the other group who are already being offered the vaccine are those women who happen to be pregnant and are working in frontline NHS positions or healthcare positions, and or working in social care. And it's really then just to follow that up with we don't know 100% the safety around these vaccines, but we do know that we've been using non-live vaccines for a considerable amount of time without adverse incident. If you do receive a vaccine in pregnancy, a COVID-19 vaccine in pregnancy, there will be a means to register the fact that you are pregnant and receiving the vaccine, such that we can then try and track the pregnancy and after birth to after pregnancy ended, to ensure that we're following up in case there are any issues. And the side effects of the vaccine is also just worth mentioning. If you do have the vaccine, having a muscle soreness at the site of injection is very common. It lasts for a day or so. It's not terribly bad. Some people are finding in the first 24, 48 hours that they have a headache or mild flu-like symptoms. Again, that's not unexpected. It's your immune system responding to the vaccine. And for some people, that response can be more severe with the second vaccination. The other thing that we've noted is that, or the other question that's been put to us is if I've had COVID before, or I think I've had COVID, should I still be vaccinated if I'm offered the vaccine? And the current advice that we're hearing is, yes, please do go ahead and be vaccinated, because we don't know if you've had a confirmed COVID-19 infection in the past. We don't know how long that immunity is likely to last for. And the second thing is that as you know, we've got this new variant, and we will have, by the nature of the type of virus COVID is, we will get mutations, which mean that there are constantly new strains of this virus circulating. So we don't know if your previous infection, that your immunity then covers you against subsequent infections. So if you have been vaccinated before, if you have developed COVID-19 symptoms before and you're offered the vaccine, the current recommendation is to take that. And so I think those are the sort of key things that I wanted to speak to today. As is always the case, when you're pregnant and or if you're breastfeeding, there is always going to be a level of anxiety about taking any medication in pregnancy. And it is very much sort of an individualized decision-making process. I have spoken to Wendy prior to this live session just to highlight that there was a lovely 2-page leaflet issued by the Royal College of Obstetricians and Gynecologists in conjunction with the Royal College of Midwives, the UK Teratology Information Service. So that's a group that really wants to find out and to study any adverse events in pregnancy that may have arisen because of any drug exposure, and the Maternal Medicine Society, the Abdominal Society. So those 4 groups have come together to create a very accessible 2-page leaflet, which if you haven't already got, I'm sure that we can find a way of posting it online. So I'm going to stop there. I'm going to switch to my WhatsApp, because Wendy said she'd sort of get some questions if we need to. So Catherine's question, let me see what Catherine's question is. If you're in a profession that would typically be higher risk, but your employer is happy to adjust your working conditions out of the front line, would you still advise a vaccine? So the simple answer to that is that the advice is, if you are in a position where your risk of exposure is higher, then if offered the vaccine, consider it. But if you're in a position where your employer has removed you from that risk exposure, then I would say that unless you're in a clinically very vulnerable category, you should consider yourself as any other pregnant woman. Okay, so for example, in maternity, we have midwives and doctors who've become pregnant during this pandemic, and they are no longer patient-facing, working from home, for example. That is not putting them at increased exposure risk to COVID. So any other questions? So that was a question from Catherine Harper. Now, I know that Wendy's on standby to talk to you after this or answer any of the questions about any other aspects of the service. There is one thing that's sort of coming out at the moment. In the first wave of the pandemic, we weren't necessarily seeing more pregnant women contract COVID than non-pregnant women, if you think about this sort of similar age range women. So we weren't seeing more 30-year-old pregnant women as opposed to 30-year-old non-pregnant women catching and contracting COVID requiring hospitalization. There's some information that's come out this week suggesting that we are perhaps seeing more pregnant women hospitalized this time. And it's not quite clear, it's early data, it's not quite clear whether that is in relation to the new strains of COVID that are circulating. So I guess the other advice to give, if you do get vaccinated, the advice is still to maintain the social distancing, wear the face covering, stick to the lockdown rules, and so forth. There's a couple more questions coming through here. So one from Emma. You probably don't know, but will teachers be offered the vaccine? So sort of thinking of pregnancy colleagues. That's a really good question. I've went on to the Public Health England website this morning, and at present it appears that we're only really looking at opening up the vaccine to pregnant women in that higher risk exposure group, but only in the settings of health and social care. So one would think that it would be, I mean, I think it'd be personally brilliant if teachers were offered it, but that doesn't appear to be in the offing at the moment. But as I say, even in the past week, information has changed. So, please do, if you're interested in knowing updates, Public Health England website is a good website. It's sometimes a little bit behind in some of the information that's there, but the Royal College of Obstetricians and Gynecologists and the Royal College of Midwives do have up-to-date information. So do check in with that. Okay, some more questions coming through. So from Kate Riley, is the vaccine recommended more for women in early or later stage of pregnancy, or does it not matter? That's a really good question. The advice we're getting out from the Royal Colleges aren't specific around gestation and pregnancy. So they're not saying it's better to get it earlier or better to get it later. For those women who, when they're weighing up the risks and benefits, if you're thinking about the first 12 weeks of pregnancy, so the major organs, all the organs in a baby will be there developing by 11 weeks in pregnancy, 12 weeks in pregnancy. So if there were any potential issues, and as I said, there is no evidence that there are issues with vaccination first trimester, then if you were concerned about even the smallest risk, it may be worth considering not being vaccinated in the first trimester of pregnancy. And that's, for example, part of the reason why we say the flu vaccine, we generally wouldn't recommend vaccination in the first trimester. So that would be that's my sort of generic gut feeling on this. I'm not saying that that's necessarily the national recommendations. I'm not aware that there is specific advice on that. So another question then, this is from Helen Nakib. If your partner is a frontline worker and you're breastfeeding, should you get the vaccine? So strictly speaking, it's your partner who should be getting the vaccine. But in that scenario, you wouldn't necessarily qualify as a priority group, and you wouldn't necessarily be offered the vaccine when it comes to shifting through the priorities and the categories. And one more question from Kerry. This is from Kerry Aldridge. Do you think trials will happen and that pregnant women be offered the vaccine alongside flu and whooping cough? I think what's interesting is the conversations happening in and around social media at the moment, that we haven't historically actively enrolled pregnant women or breastfeeding women into trials. So there is a call put out from the national bodies, such as the Royal College of Obstetricians and Gynecologists, really asking the question that if we're going to have trials, then we must consider this group of women. It's almost a sort of a discrimination not to consider the needs of pregnant and breastfeeding women by excluding them from trials. So I don't think there will be trials specifically around this. I think what will be really important is in the current times that where we have pregnant women and breastfeeding women being vaccinated with the COVID-19 vaccine, that we have a means of registering these women and then following them up through pregnancy and after the birth of their child. And so the one thing I haven't touched on specifically is how do you get registered if you've had a vaccine? And that's still been, the details of that are currently being ironed out. At present, I don't have that. How do you register yourself if you've had a vaccine? Other than that, if you are offered it for any medical reason, so if you happen to be in a clinically very vulnerable group or you're a frontline worker, please do let the person who's vaccinating you know that you are pregnant so they can mark it down on the form. But I'm expecting the next week or so we'll have more information around the registration of those women who are pregnant or breastfeeding who've had the COVID-19 vaccine. So the other questions, so from Trudy Brock, hello Brenda, I wasn't totally focusing, that's okay. Did you just say you would not recommend flu vaccine in first trimester? Trudy, you might be catching me out here. I didn't think we routinely offered the flu vaccine in the first trimester. Now, what I'm talking about today isn't what we in maternity are recommending. What I'm trying to do today is really just impart to you the advice and the information that's coming from the Royal College. So it's not that I'm advising you must get vaccinated. It's more that we're not routinely vaccinating all pregnant women, but it may be that as we move through the prioritization, that those women who are clinically very vulnerable and pregnant would be offered it alongside non-pregnant people who are clinically very vulnerable as well. And that, as is currently happening, if you're a health worker in the NHS and been offered the vaccination or are pregnant, that you should consider having a discussion with your professional, your healthcare professional, your obstetrician, GP, midwife, so that you're making an individualized, personalized decision about whether or not to have the vaccine based on your specific circumstances. So as one of the earlier questions put to me was about, if I'm not actually frontline working, if I'm actually removed and working from home and pregnant, should I still consider it? Well, in that situation, you're not at higher risk exposure. So you may feel in that situation that actually the benefit isn't there against the unknown risk of the vaccine. A few more questions coming through. So from Molly East, can breastfeeding women have the vaccine? Sorry, just joined. So I hope, Molly, if you've just joined, you may have just heard me say that we're not routinely, there isn't a consideration of routinely offering the vaccine to pregnant women and women who are breastfeeding, unless you would fall into a clinically very vulnerable category because of a pre-existing medical problem, or if you're a frontline health and social care worker. And the moment the offering, I say that, use the word offering loosely, it's that you may wish to consider when we come round to vaccinating or offering vaccinations to that particular group of people. Another message coming in, Shirley Broughton. I'm a nurse at 28 weeks pregnant now, working from home, but my husband's a frontline worker. My son attends nursery to allow me to work from home. In view of this and increasing rates of COVID in the population, should I consider being vaccinated? So in this scenario, my understanding of where we are is that because you're working from home, Shelley, and not actually in hospital, I'm not sure if your occupational vaccination program would still offer you vaccination. I understand that there would be that risk of exposure from your husband and your child in nursery, but presumably if your husband is a frontline health and social worker, he would be vaccinated. And as I say, there's not a sort of a sense that I get that you'd fall into one of those two categories. Although I do acknowledge the anxiety you'd have about your son going to nursery. I'm just looking through to see if there's any further questions here. Wendy, you can message me if I have missed any questions that have come through. I think I've covered all the questions. Okay, so I hope that has... Oh, there's one more question, sorry. Okay, so this is coming from Samantha. I had COVID over Christmas and I'm 29 weeks pregnant. I was advised that I should be offered a growth scan because of having COVID. Is this correct? It is correct, Samantha. So what we are doing within our trust in OUH is offering women who've had COVID, whether you've been symptomatic or not symptomatic, if you've got a COVID positive test, a growth scan. It's usually about 2 weeks after your positive test, but the exact details of that, it will be very individualized because we also obviously have to take into consideration the period of isolation to make sure you don't come into the hospital when you potentially could still be infectious. So the short answer is yes, you should have a growth scan. If you are, in fact, if you haven't had that arranged, then please contact your community midwife and she can fill in a request form. And on that form, if she just states the date that you had your positive test or the date of onset of symptoms, and then we can ensure you have that growth scan arranged. Okay. So a message from Katie. I'm a type 1 diabetic and I understand I could be offered the vaccine in March. Would it be an issue if I fell pregnant soon after the vaccine? I presume I wouldn't be offered the vaccine if I was trying to fall pregnant. That's a really good question, Katie. So this comes back to two considerations. One is, would the vaccination affect fertility? And the short answer to that is it doesn't appear to. Again, it hasn't been trialed specifically in women trying to get pregnant. The other question is, if you happen to get pregnant, if you had the vaccine and then you happen to fall pregnant, so in essence, you're having the vaccine in that early stage in pregnancy, the current thinking, and this is again drawing heavily on the data from flu vaccination and from whooping cough vaccination and from even sort of women who've had other types of vaccination who then happen to get pregnant a short time after that. And it's drawn from the data of women who were enrolled in the large trials around the two different vaccines who happened to get pregnant during that time, shortly after being given the vaccine. It doesn't appear that there are any adverse effects on early pregnancy development. So, the caveat in all of that is that it doesn't appear. But if, for example, if you fell pregnant shortly after the vaccine, I think the message I'm getting from the reading of the research so far is that you shouldn't worry unduly. Okay, so I think that is all for now. If you stay on the line, Wendy will be following on after me to answer any other questions about more general maternity stuff. So meantime, take care, stay safe, and good luck with your pregnancies. Bye-bye for now.